Hey guys, what's up? Welcome back to my channel. So today we're gonna be doing episode 4 of the dental assisting series, and I got a guest with me. This is Jerry. So me and Jerry went to TCC together, and we did the dental assisting program. So I told you guys I would be bringing like a guest on, and he's a male, so y'all can ask him all the questions you want to, and then I'll just bring him back another time. But today we just got a couple things to talk about with him. What was your experience like at TCC or in the dental assisting program?
In TCC, there was a lot of females in there. But the thing with that was that I just spoke to them how any other person would. I don't understand. Like I didn't really see the difference that they treated me. But once I'm hearing Destiny and them talk about it, yeah,
they treat you different. The heck. So what would you say would be like the hardest thing that you felt like was hard about the program?
The hardest thing, the actual bookwork, because the clinical stuff, things on my hands, I was easy at that. That came to me naturally, but like actually doing the bookwork, you would think it's nothing because like, they'd be like, dental assistant is not that, it's not gonna be that hard. Yeah. But there is really hard classes, and you really go into like the science of the tooth and things like that. Yeah. Like in dental anatomy, where you go like you break down the tooth. Yeah.
When I passed that class, I was like, how? It was hard. Because I struggled in regular anatomy too, so that was kind of hard. It is in depth.
And then dental materials where you play with chemicals and stuff like that. Like if you don't know the science behind it, you could burn your eyebrows off.
That's true.
And there's chemicals in there that will burn the skin off your fingers.
And I feel like now since I'm working, I kind of feel like the school could have maybe put a little bit more emphasis on dental materials, because like I work in general, and he works like for I work for a private office, and he works for like a public office. I'm not gonna tell y'all specifically where, but he works for a private office, and it's kind of like different. I feel like I do more stuff, so it's like dental materials, that stuff really be coming up. Like remember when we made the trays, when we melted those trays, I actually had to do that, and I had to remember what we did in dental materials. So yeah, make sure if y'all taking that class that y'all take it seriously.
You know what department in dentistry you go to? Like, I said department, what? Like branch of dentistry you go to? Like public health, ortho, pedo, and then there's general dentistry. You would do different things. So everything they teach you in school, you will need it, but just not in every type of practice. Yeah. Like the things I do in public health, they don't do in general health. Yeah. And the things they do in general health, we don't do in public health. We don't use materials, but we went over all those materials in class. Yeah. We just don't use them. Yeah. But like if we was to transfer, they would teach us back to.
Jerry's been at his job for a while. I've been at my job for 7 months. Do you feel like that was a good choice to go straight into just like a public place where you do like one thing? Because in general dentistry, like I do pretty much everything besides something that requires like a specialty. Like if you need a root canal that's going to be problematic, you're not going to come to see my dentist, but he does do root canals. Or if you need like braces, he's not going to do that, but we'll clean your teeth, but you got to take your brackets off. Basically, we do everything unless it's something that can cause an issue, like extracting a wisdom tooth. So do you feel like that was a good move for you to get as your first job, or like do you feel like you're gonna forget stuff?
I mean, because I do see the things that you don't do. Yeah. Like the extracted tooth you just talked about, we do that. We take out the teeth, we do restorations, we do like small surgeries like putting crowns or root canals on kids. And then we do like, well, that's not a small surgery because it's still invasive. It's just that we're not doing it on an adult. Yeah. And then because in public health, you can have two sides of it. Because where I work at, there's an adult side and then there's the kid side. I mainly work on the kid side, but whenever they need help on the adult side, I'll walk over there too. So I get the best of both sides. Yeah. So
my boss don't do kids. We don't do kids. I ain't never seen a kid in my office.
See, the things with kids is there's all right. So when kids come there, of course you get those crybabies. There's a difference between a kid that is a crybaby and a kid that is just scared. The kids that scared, I nurture them. I get them to where they like dentistry. But the crybabies, they get on my last nerve. Because you can just be holding your instrument, they gonna start crying. Yeah, what you crying for?
I've had a kid pee on me at an internship. He bit me, he peed on me, he wilded out. So
they do that?
They go off, but you still gotta, look, you gonna get this feeling. So
I had a kid spit in my face. I had a kid pee in a chair. I had a kid.
Yes, they pee in the chair like it's nasty.
I have kids do all types of crazy. I had kids reach up and try to grab the instrument, and then I had to take that hand down.
No.
And it was not great.
I'm gonna send you to Where do they send the kids that act up to? Somewhere else.
They send them to the hospital.
Yeah,
put to sleep. Yeah. And then they just do everything.
I'm not. But,
and then there's things like Nitrous. Nitrous helps calm the kid down.
Yeah, and also with Nitrous, adults, we do Nitrous too, but like adults can be on Nitrous, so don't think just because you are, you get a grown person that they're not going to be hooked up on Nitrous, because sometimes I'll look and I'll see the patient wants to be hooked on Nitrous, and it could be a problem because it takes longer. So I work in a fast-paced office, and we have our patients running every 15 minutes. So every 15 minutes, I have a new patient, and that's including surgeries, filling, it don't matter what you're doing, 15 minutes, we getting another one. So it's like when you want to be hooked up to Nitrous, I'm hooking you up to the Nitrous, but it's like I have to hook you up, let you, breathe it in, and then after I gotta let you calm down from the Nitrous. So it's like,
yeah,
Nitrous is mostly for people who are nervous or they have anxiety and stuff like that, or have had a bad experience at a dental office.
I never did it with the adults. I didn't know it'd take that long.
With the kids, yeah, we usually put them on it, and then maybe like not that long, but he usually lets them like, cause they be really shade if you like Nitrous. I'm just saying, they be beating to be hooked up on the Nitrous. Like I left the program early because I didn't pass the radiology course. So Jerry actually went through with the whole course. So I left in spring semester, and we were set to graduate in the summer of what June. Y'all graduated? Yeah, June. So first, what were the classes that you guys took? And yeah, what were the classes y'all took?
Classes we took were like office emergencies, and in office emergencies we learned what to do when patients have certain episodes or things happen to them while they're in chair. For instance, like a heart attack, you know what to do with a heart attack, or if they had allergic reaction, or they had like a diabetic attack and they need like some orange juice or something like that to get them back into play, or you need an EpiPen for certain things. And I'm not really, the thing with office emergency is, since it don't happen that often, you don't really think about it. So I learned this stuff, but naturally I forgot about this stuff. So like if it was to happen, I'll be screwed. I ain't gonna lie.
One time, and I'm gonna do a video on like the mistakes I've made in the office. Not that I've made like dire mistakes, like I set the office on fire and stuff, but it's just trial and error, and you're not gonna be perfect. So, but I remember one time like I didn't look, so that's why it's very important, like when you're in school and when you're working, whether you're doing on-the-job training or if you go to school, you want to always make sure that you look at your patient's chart, because on the chart it will tell you if the patient has like a heart condition or whatever, and there's certain oh my god, there's certain anesthesias that can make the heart rate go faster. So there was one time that I didn't look at that, and I loaded the syringe with a regular, of course the dentist caught it, but if he didn't catch it, that would have been a problem. So basically, like, that could have been an issue where I put a patient at risk or whatever. So you can't always, I mean, my dentist, he's like swift with it, so he already caught it, and he let me know, like, that's very important to check those things. But yeah, office emergencies, take that class seriously too. People ask me all the time, which one should they do? Should they apply? Should they go? And I always tell them I would go, because it's like if you don't know anything and you do on-the-job training, they really don't have time to be like, this is this and this is why and blah, blah, blah. If you go to school, you'll already have that knowledge beforehand. So if you had the option to do on-the-job training instead of going to dental assisting school, which one would you take?
I would have still went to dental assistant school, because when you get the experience you need, you learn, like they go through everything step by step. So there's not nothing that you're going to see that's going to be like, oh dang, I didn't know this was going to happen, or this is like super new or something like that, because you know this stuff. And then learning it is more easy, because when you on the job training, they teaching you, but they still have work to do. Yeah. In school, they take the time to teach you, so they can sit there and nurture it and get it to where you absolutely know this thing and learn it. Rather than them teaching you in 5 seconds and then going back to their patient and then come back to you to do something else. Because
I feel like there's stuff we learned a lot of stuff in dental assistant school, but there's some stuff that I didn't learn. Like, for example, I did not learn, at least I don't remember learning about the wax trays.
We learned about that.
I don't remember that. So I don't remember the wax tray thing. But anyway, because I didn't remember or whatever, my boss had to show me, and because he had to show me, that took time out of what he wanted me to already know how to do it, and I didn't know how to do it. I didn't even know where it was in the office or anything, because that was the first time that he had to use one. So I was like, dang. And he was kind of like ticked off because he was like, oh, you don't know it? So yeah, I forgot some stuff. So
I mean, but she
yeah, he not like, I don't work for the nicest dentist in the world, and like they're not always gonna be nice.
You like my dentists, they are crabby because they're old. So once
don't
you get
say because they're old. It's not because they're old.
It's
not
because they're old.
I feel like it's because they're perfectionists, and they have been doing this for what, most of the time like 20-30 years. They already know, they know it. Like,
I mean, but when you get a dentist that's old, they already, like you said, they work 20-30 years, so they're stuck in their ways. They're stuck in their old ways.
Yeah.
So like things that would have been okay back then, you know, the times change and stuff like not cool now.
Internships, they're gonna be nice. They're going to be so nice.
But that's fake. All fake.
They're so nice.
Fake.
I got hired. I was like, hold up. Because my coworkers was like, really, they were really trying to, like, I don't know, I don't want to say protect me, but just make sure I was like on the ball with everything. Like, the next week I came to where he showed his true colors. So yeah, them internships are, I mean, there are some dentists that are nice. Like, there's some dentists that are genuinely nice. For me, because I'm young too, they're always like, oh, she just got out of school and da-da-da-da-da. You know, if you just come in there and, I don't know, I just feel like I would just go to DA school.
We took Nitrous. Nitrous was like a 6-week course. It was super easy. They taught us about the tanks and then how to measure the valve and all that, and how you're not supposed to measure the valve, but you're supposed to monitor it, because if the dentist forget, you're supposed to be on that. So you're supposed to learn to, like, you're supposed to learn to monitor the gauges and whatnot, but you're not supposed to touch it. Like, so yeah, that class was super easy. I got an A in that.
Took office management.
Office management. Now that class was a lot of book work. Yeah. It's not. I wish it was hands-on, because I wanted to know some of the things that the front desk people do. And
yeah, I do some front desk work. Like, I be up there.
And I think that's cool.
Yeah, I be up there. I kind of like, it was one week I spent majority of my days up there in the front, because our assistants, they rotate from like front to back. Like, it just depends. If somebody's sick, then you might have to go up to the front and stuff, because I work at a smaller office, but where he works is bigger, so you may not have to do that.
I'll be wanting to do it, but that's why I want to know, because I want to do myself. So, like, if they take it too long up front and then the patient is still sitting here, I'm like, nah, they gotta go.
Yeah,
so that's
yeah.
why I
So it's a good skill, like, to know how to also do stuff in the front and do stuff in the back, because then it's like you can do everything. Because
in my office, I work with another guy. Me working with another male is pretty cool. We don't get into the drama with the females, but there are still, the females outnumber us in the office anyway. Yeah. And it's not that females are bad or anything like that. I'm not trying to say that they're not much drama. They can't
help it. Work. I feel like no matter where you work, though.
Not me. Our office is cool. I think it's because we have 2 guys in there. All the females just chill.
What are like some mistakes you made in the beginning that you like learn from, without being too specific?
Some of the mistakes I made? Not reading. Like, if you in there and then doctors tell you to get things and you just rushing and getting things without reading it, you will fuck yourself up.
I've actually been asked to get something before, and I'm over there like looking at the wrong thing, then bring the wrong thing, and then he literally has to get up and go get it.
And they get mad at that. That's not a good thing. You bringing them the wrong thing ever, just bad.
Bad. Don't do it.
Don't bring the wrong thing.
Don't do it. It's like where I work is so fast that I don't even have time to ask somebody. So it's like sometimes it'll be something that maybe I never seen before, and he might think like they went over that with me or something. But it's like they don't go over things with me until it occurs.
You just want to learn how to you're gonna have to learn how to take it. I take it. Yeah. Or, because like if I'm in the wrong, I'll take it. But if I know I'm in the right and you do it, nah, that ain't gonna slap. Put your foot down. Okay. Let them know that that's not cool. Because if you don't, they're gonna do it all the time.
I think that's like an issue that I'm having. Like, I'm having an issue with like finding a balance between still respecting him as my boss and also my elder, but also putting my like foot down as far as like how you speak to me and how other people in the office speak to you. Because everybody in my office is over the age of 40, so they look at me. They look at me as like basically a little girl, and they think they could talk to me like. I mean, when they call me baby and sweetie and stuff, I be like, oh yeah, they being nice today. But when they do it in like a condescending way, like I don't know anything and stuff, it's like, hold up, because you were in my position at 1.2, but it's like,
and I'm gonna get this.
Yeah.
Like,
I'm not gonna let y'all just talk to me any type of way. So I'm still trying to figure out. So that's why like. I think episode 2, when I was telling you guys I'm trying to build relationships with them, is not because like I'm trying to be best friends with them. It's because I want us to have a mutual understanding and be able to like flow together in the office and work well, because we have to do six-handed dentistry. Six-handed dentistry. 6. That's when you got a dentist, you and another assistant. So that means like I might be assisting and the other lady will be like writing up a chart or doing something else that he needs to do. Like it's like that's how we have to work.
That means her dentist is old as hell, because you
didn't go over that in school. So
600 dentistry is from like the prehistoric time.
I just wanted to show you guys like the contrast and where you could work and the different work environments. Some places are a lot slower and some places are a lot more fast paced. Some people are rude, and then some people are not.
Yeah.
So really just don't take stuff personal. It's hard not to. It's very hard not to, but
yeah, because like when you do take it personal and it's not a big thing, you're gonna be like, dang, why I did that?
Yeah, like don't get emotional and stuff. Like if you get emotional, go to the bathroom and then come back out. You're
gonna have to have thick skin, because there's gonna be some certain situations where things come up and you're gonna have to brush that off. Because if you don't, you're gonna end up quitting, and then you go without a job, and then all this life happens.
Yeah,
so it's like
make sure that you guys leave any questions or comments you guys have down below, and if you guys want Jerry to come back, I can bring him back. But this is like really impromptu. I didn't even know he's gonna come. So thank you for coming, and yeah, just leave any questions you guys got down below, and I will see you guys in the next one.